Thank you very much for listening into this recording today of What the Heck is in Vaccines. My name is Robert Brayden. I am a professor of pediatrics here at the University of Colorado and Children's Hospital Colorado. My disclosure slide says that I make no money, I get no support from pharmaceutical companies. No photograph is of any patient that I have taken care of. They are all patients from internet photographs. Use of trade names in this talk does not imply endorsement of the vaccine. I endorse no vaccines. Poisonous or harmless? I'm going to talk about these four chemicals, and I think you'll see the relationship to vaccines here in a minute. Plutonium, lead, vitamin A, or water. Are they poisonous or harmless? And many would say that plutonium is poisonous, and lead can certainly be poisonous. Vitamin A, not so much, and water, well, the point I want to make, and it does relate to vaccines, is typified by a statement that was made by this man here. This man is Paracelsus. And Paracelsus was a Renaissance man. He was born in 1493, and he was an alchemist, a botanist, a doctor, an astrologer. He kind of wandered around a little bit. He really was a Renaissance man. He made the statement, the dose makes the poison. The dose makes the poison. And so the point is, one atom of plutonium, one small amount of lead or vitamin A or water, well, small amounts are not harmful, but large amounts, large doses of anything can be themselves poisonous. And the same is absolutely true for vaccines. Like all chemicals, the contents of vaccines could theoretically be poisonous, or if they're present in small enough amounts, they can be harmless. Well, it is the fundamental premise of this talk that in the amounts that are in vaccine doses, vaccines are extremely, extremely safe. And that it is much safer to get a vaccine than to not get a vaccine. Vaccines prompt the immune system to undergo biologic reactions that would be caused by the disease itself, but do not induce the illness. What the heck then is in vaccines? There are 5 classes of antigens of constituents that I want to talk about today. Antigens, preservatives, and antibiotics. These are agents that basically keep things from growing in the vaccine. Buffers, stabilizers, and solubilizers. These are things that keep things from sort of clumping up in the vaccine vial or sticking to the vial edge. Adjuvants are in vaccines. Adjuvants enhance the immune system, and they ultimately make our bodies develop a better immune reaction because the adjuvant is in the vaccine. And residuals are in vaccine, and residuals are chemicals that are used in prior stages of vaccine development, but are essentially removed in the final step, so they're not present in very large amounts in the final vaccine. And here's a schematic of antigens. Antigens are the very reason why we want to get a vaccine. We develop antibodies to those antigen proteins Sometimes they're polysaccharides or polysaccharides that are conjugated with proteins, but inevitably we develop antibodies. We also develop cells or cellular immunity that has ability to protect us, but is much more difficult to measure. Antibodies are in the serum, so we can draw the blood and measure antibody development against antigens. But antigens induce both cellular and what's called humoral or bloodstream immunity. There are several different types of antigens in vaccines. Toxoids are inactivated toxins from the bacteria. We inactivate them with chemicals and then remove those chemicals to leave the toxoid. There are inactivated killed viruses, polio and hepatitis A, recombinant surface proteins. So hepatitis B is just a surface protein that's manufactured by a bacterium. There are viral proteins, inactivated influenza. There are live attenuated viruses. The measles, mumps, rubella, and varicella viruses are live viruses, but attenuated. They're not pathogenic. They don't induce illness. The same is true for rotavirus, which is not injected, but is given orally. It is a live virus that lives in the gut. The live attenuated influenza vaccine, LAIV, lives in the nose and serves as a vaccine against influenza. Bacterial proteins against whooping cough or Haemophilus influenza, pneumococcus. There are 13 different kinds of conjugated bacterial proteins against the surface coverings of pneumococcus. And there are 4 types of conjugated polysaccharides that serve as antigens against meningococcus. So we protect against several different kinds of antigens when we vaccinate. How vaccines work, there is a video that I would certainly recommend to everyone, and it's a video called Immunize for Good. It's on the Immunize for Good website, How Vaccines Work. It's a short 2-minute video, and it says how these antigens work, these different 5 different classes of antigens, how they work. So it's a good resource. Well, also in vaccines, not only are there antigens, but there are preservatives and antibiotics. Preservatives prevent the growth of bacteria and fungi. They are functionally defined, so anything can be a preservative as long as it keeps bacteria from growing and it actually kills yeast as well. So there are defined challenges that define whether something is a preservative. And so you challenge with Candida albicans or Aspergillus niger, which are yeast, or E. coli, Staph aureus, or Pseudomonas, which are types of bacteria. And if you pass, you get FDA approval as being a preservative. And so there are several different kinds of preservatives in vaccines, but a preservative that was used for a long, long time, since the 1930s until the 1990s, is one that has raised more concern, and we'll talk a little bit more about. Thimerosal, shown in this slide, actually has one a mercury atom in it, and it's that second little Hg there sitting out on the edge of this molecule. But that mercury, which is an ethyl mercury, is potentially a risk to humans. But remember, thimerosal has never, ever, ever been shown to be harmful to people. In vaccines, thimerosal was used in millionths of a gram, roughly 25 millionths of a gram of thimerosal served as a preservative in multi-dose vials. So we have to use a preservative because inevitably contamination occurs. There are several horrible stories of vaccines being contaminated and actually inducing serious diseases in humans. So the FDA requires that we actually use a preservative when we have a multi-dose vial. In the 1990s, because of this mercury that's in thimerosal, thimerosal was removed from vaccines in the US except for one vaccine. It's still in multi-dose influenza vaccines and is a preservative there. But it's an excellent, excellent preservative in very, very, very tiny amounts. It serves to kill bacteria and prevent yeast from growing. Mercury, we should remember, is a naturally occurring element. Is present in breast milk. A baby in the first year of life receives 15 times the amount of mercury than is in an influenza vaccine if they are breastfed. So remember that you're going to be exposed to a little mercury anyway. Like Paracelsus, the toxin is in the dose. And so because mercury was found in very tiny amounts in vaccines, it's never ever been proven to be toxic. Antibiotics. So remember that they are residual from cell culture. There's several antibiotics that can be in vaccines. There are some preservatives that are also in some vaccines, even though they are not multi-dose vials. So phenol is in Pneumovax 23-valent, not routinely used for kids, but it is present in that vaccine. And there are some other preservatives, non-thimerosal preservatives that are in other vaccines. Stabilizers. Stabilizers are also present in vaccines, and they mainly are there to help the antigens remain immunogenic when the vaccine is freeze-dried. And freeze-drying is removal of water, and freeze-drying prolongs storage. So it helps the vaccine remain viable for longer periods of time. Fewer and fewer vaccines are now freeze-dried, but some of the constituents are still in the vaccine to allow freeze-drying of vaccines. Freeze-drying constituents that are stabilizers for freeze-drying include sugar, sucrose, sorbitol, amino acids, and proteins in various amounts. Albumin and gelatin can also be stabilizers, and those are bovine or porcine cattle or pig products, and those proteins can be rarely anaphylactic to humans, and gelatin is probably one of the more anaphylactic inducing chemicals. There can also be prions that can be in cattle products, and prions comes from the word protein and infection. It's a combination of those words, and it's an unusual form of, well, it's a form of a protein, and some would question, well, is this life or not? because the protein, it's theorized, it probably does this. It's misfolded initially, and then it lines up with other proteins in individuals' brains, for example, in bovine spongiform encephalitis, encephalopathy, BSE. It lines up with the proteins, and then it reconfigures and causes the misfolding of that same protein. And so BSE ultimately causes encephalopathy in the affected cow, and it really loses the nervous system function. And so conceivably, it could be very dangerous to humans to ingest those proteins as well. So we source vaccine products that come from cattle from non-BSE countries. If a country is found out to have a BSE event, then the FDA does not allow that any bovine product coming from anywhere in that country is allowed. And that's one way to, again, protect our vaccine stream from prion-containing infections. Non-human products can induce encephalitis. Non-human products can induce anaphylaxis. And it's rare, but it's something that we need to always be prepared for. There are 5 known cases out of 7,600,000 doses of vaccines. And so anaphylaxis, or IgE-induced swelling of the airway, can occur. And it's very important to be able to be responsive if there is an anaphylactic reaction to any vaccine constituent. Epinephrine, Benadryl, or diphenhydramine need to be quickly available and administered in an emergency type of setting. I think a mock reaction drill is a good idea for practices to be ready to respond to a vaccine anaphylactic event. The most important anaphylactic constituents can be, as I said, gelatin, calf serum, egg protein. There can be anaphylactic reactions to antibiotic residuals, yeast proteins, and even the latex packaging. Latex is in the stoppers, the tops of some vaccines, and even that in residual tiny amounts can be anaphylactic. Buffers and solubilizers, there can be hydrochloric acid in vaccines, a tiny, tiny, tiny amount to adjust the pH to a more acidic level. It is present in some DTaP vaccines. There is a chemical called polysorbate 80, which is an emulsifier and solubilizer. It keeps the vaccine constituents from sticking to the edge of a vial. And it's very, very safe, but again, theoretically, it could be allergenic, even polysorbate 80 or tween. Adjuvants, another one of the constituents we talked about of vaccines. An adjuvant is a substance that is designed to improve the immune response. Most adjuvants in vaccines, almost all adjuvants, are aluminum-based compounds right now. There are a few others, we'll talk about them. But most adjuvants are aluminum-based compounds. They are right now, thankfully, crystalline in nature, and we'll talk a little bit about that. During the first 6 months of a child's life, a child in receiving all vaccines would receive about 4 thousandths of a gram of aluminum, 4 milligrams of aluminum. And there is aluminum in breast milk and in cow milk formulas, and even in soy-based formulas. There is something like, 30 times the amount of aluminum is in soy-based formula that would be ingested in the first year compared to, or in the first 6 months compared to the ingestion of 4 milligrams of aluminum in vaccinations. So the aluminum adjuvants are aluminum oxyhydroxide. It's crystalline aluminum, and it has a very, very high surface area because it's crystalline. It's like, I think of it as a, like scaffolding. It's very, very, has a great surface area. And like scaffolding, it serves as a great adsorptive of antigens. So antigens will stick to it very, very well. And yet, because it's crystalline, it's also solubilized by human acids that are in our bloodstream. So citric, oxalic, or malic acids will dissolve the aluminum adjuvant and help the kidneys get rid of the individual aluminum oxyhydroxide ion, so that within the first 24 hours after a vaccine is given, about half of the aluminum that was in that vaccine can be measured in the urine of the individual that was vaccinated. We don't know exactly how aluminum works as an adjuvant, but it potentiates the immune response either by serving in a depot, it increases inflammation by drawing cells into the area, or it may be the adsorptive quality by causing the antigen sort of to stick to the aluminum oxyhydroxide ion and serving as a way for the antigen presenting cells to kind of get a hold of the antigen. We don't really know how it works, but it is absolutely clear after many, many years of using aluminum adjuvants, it serves as an immunopotentiator for vaccines. There is some report of a process called macrophagic myofasciitis, which one French physician is saying is the result of aluminum in vaccines. It's very controversial, has not been replicated by other people finding it, and I think it's more or less, in my mind, less likely to be found to be a true problem. Certainly millions and millions of doses of vaccines have been given with aluminum as an adjuvant, and probably MMF is not a serious problem as a result of the aluminum in vaccines. As I said, there are other types of adjuvants, including monophospholipid A, a constituent of endotoxin, bacterial lipid toxoid, and it is used in one of the 2 human papillomavirus vaccines. And we may hear more about other non-aluminum adjuvants in the future. But again, all adjuvants are thought to be safe right now. Residuals in vaccines, there is trivial amounts of residual formaldehyde. Formalin is the water-solubilized form of formaldehyde, so essentially the same chemical. Glutaraldehyde. These chemicals are used to inactivate toxoids, diphtheria and tetanus vaccines, and yet preserve the antigenicity of those toxoids. They then are still present in very, very small amounts in vaccines. They are, again, not considered harmful. Residuals, the leftover stuff from the pre-manufacturing steps before putting the vaccine in the vial. There are a few proteins left over from yeast and egg. There are cell wall constituents from the kinds of cells that are used to grow viruses, monkey kidney cells and Vero cells. There's DNA that's residual. So you do have very, very small trace amounts of those types of residuals present in vaccines. What is not in vaccine? Historically, antifreeze has been said to be ethylene glycol, and that decreases the freezing temperature of water. Well, there is a chemical in vaccine called propylene glycol. It is not the standard kind of antifreeze that's used in cars, okay? So you're not going to be pouring any propylene glycol into your radiator anytime soon. Propylene glycol does serve, in a sense, to lower the freezing temperature of water. So it is used in some ways as an antifreeze agent, but it is not used in automobiles. Propylene glycol is used in many, many foods. It does reduce the freezing temperature, as I said, but it is not considered standard automotive antifreeze. Antigens are grown in fetal tissues, but vaccines do not contain fetal tissues. The story of this is that in the 1960s, 2 cell lines were started to grow viruses in them, and you have to have human embryonic cells to have vaccine viruses grow in them. And these 2 cell lines have been immortal since the 1960s, continuing to replicate and grow. The Vatican Pontifical Academy for Life made a statement in 2005 saying that parents who do not choose to have their children vaccinated with vaccines coming from these cells are, quotes, in more proximate cooperation with evil than those parents who give their children the vaccines in question. This academy does advocate the removal of viruses from the cells if another cell type that does not result from an abortion is available. There isn't one available right now, so we do use vaccines, particularly varicella vaccine comes from this type of cell, but we have no choice right now, and if it develops, that may become a recommendation to avoid that use, but there are not cellular constituents from fetal tissue in the vaccine itself. The virus was simply grown in the fetal tissue. 5 different classes of chemicals that are in vaccines: antigens, preservatives and antibiotics, buffers, stabilizers and solubilizers, things to keep things from clumping together or sticking to the walls of the vial, adjuvants, which enhance are immunopotentiators, and residuals, the leftover chemicals from the pre-manufacturing steps. A list of all of the different kinds of chemicals that are in vaccines is on the website of the Pink Book. The CDC Pink Book lists those if you want to look at them. There are probably 200 different chemicals that fall into one of those 5 classes of types of chemicals. The package insert also includes all of the chemicals that are in vaccines. So Paracelsus was really right. The toxin is made by the dose. The dose makes the toxin. If you had too much plutonium or lead or vitamin A or even water, conceivably they could be toxic. But in vaccines, we have very, very small amounts of potentially threatening agents, even including thimerosal. And the doses that are in vaccines are all very, very safe. And in fact, we are much safer, like this little guy, to get vaccinated with the antigens we need against the 16 diseases we can prevent and not suffer the consequences of the wild type disease. So thank you very much for listening in today to this talk. And if you have questions about vaccines, please contact the Colorado Children's Immunization Coalition, and we will try to help you answer those questions. We also have vaccine cards that tell you about the schedule of vaccines. So look for those and check out the website at, what's the? children'simmunization.org. A good website can help you get the answers about vaccines that you might have. Thanks very much.